likelihood that we will have significant disruption to schools. We've already seen a couple of schools closed. All of that will be based on the very best health expert advice to protect public health, to protect students, teachers, and of course other vulnerable people that those younger Victorians might come in contact with. Again, flattening the curve will things. We've said for a while now, quite a few days, that we'd be asking Victorians to do things they've never been asked to do before. And we are seeing, with so many events cancelled, such disruption, we are seeing the impacts of this. It's going to touch all of us. It's going to affect all of us. If I get advice to close schools from our health experts, I will not hesitate to do that. I don't have that advice today, but if and when it comes, and it's much more likely when rather than if, we will act swiftly.
Will that be a state decision, or is that something you're going to refer to the National Cabinet? Is Victoria prepared to go alone on any of these measures?
Well, that is a state decision ultimately, but part of the National Cabinet, very pleasingly, one of the results on the outcomes of COAG on Friday in Sydney was that we should all be as coordinated, as consistent as we possibly can be. I don't rule out us having to do things slightly differently to another state, and indeed that was acknowledged when that National Cabinet was set up. Each state is different. Education in each state is different. There are different circumstances that we each face. But to the best extent, to the utmost, we should be consistent. We should try and have that unified approach. And there is more than goodwill. It's common sense as well to try and be as consistent as we can. That's what the National Cabinet's about, and that's the sort of decisions that the National Cabinet will consider today. And I think you'll find that the Prime Minister will in fact be the spokesperson on behalf of that National Cabinet, rather than us all trying to give you the outcomes of that meeting. It'll be one of many meetings. I think we've agreed to meet weekly, and we may meet even more often if circumstances dictate.
Does Australia go the way of New Zealand and Israel, set up anyone who comes in it's 14-day quarantine, mandatory, limit borders?
The first point I'll make is that it's a little difficult to explain why, say, China, who have very few new cases, there are travel bans there, but the United States, people are free to travel when we're seeing many, many new cases, and indeed the majority of Victoria's new cases are connected to those who have travelled from the United States. I think that arrangements similar to New Zealand will absolutely be on the agenda to be discussed today. I think New Zealand-type travel arrangements will be on the agenda at 12 o'clock today, as they should be. But we need to do everything we can to flatten this curve, and I think that there is more that we can do when it comes to travel.
Has politics trumped some of the decision-making when it comes to, say, the US travel bans, or lack of?
Oh, look, I'm not going to get into those sorts of debates. I'll leave commentary on the politicians to you guys. That's your job. My job, and the job of all First Ministers across Australia, is to take advice and to work as hard as we can in a unified way to protect public health, to flatten the curve of COVID-19 for COVID-19 patients, and also for every other patient who needs our health system to be operating as best as possible.
Premier, you talk about unified messages and consistent messages. Brett, this is not a gotcha question. Brett talked yesterday about people buying 2 weeks worth of groceries.
Yes.
Chief Medical Officer's been on TV a few minutes ago saying that advice was a bit premature. Where's the unification?
Well, there'll be differences of opinion. People are not robotic. There will be different views from different people. The essentials, though, have to be consistent, and I believe that they have been. I'll give you another example. There are some businesses, there are some families, there are some sporting clubs and cultural groups who are going above and beyond the public health advice that's been provided by Brett, by Brendan Murphy, by others. They're not to be criticised for that. An abundance of caution is a good thing, and that's what guides so much of our response to the advice that we have received from public health experts. That will not change. I'm not critical of any business that's decided not just to discourage travel, but has actually said to their workforce, we're not travelling anymore. We're going to try and work from home as much as possible. We're going to reconfigure offices so that workstations are further apart, that hand sanitizer, all sorts of different protocols. Some of them are over and above the advice that's been provided. I'm perfectly comfortable and indeed very grateful for the work that Brett and his team have been doing and will continue to do for many months to come.
Do you personally think that people should be stockpiling 2 weeks' worth of supplies?
The advice that's been provided is in terms of staples, the sorts of things that you would need if you did have to self-isolate. It is sensible to try and have some of those on hand, more than you would normally have. I would just make the point though, if everybody goes out and buys not 2 weeks worth of staples but 2 months worth, the shelves will be empty, and the only people who suffer then are vulnerable people who might not have got to the shops or can't go to 4 different supermarkets to get the basics that they need. They happen to be also the people who are most at risk of becoming quite seriously ill because of COVID-19. We're all in this together, and if we all use common sense, then we will get through this together. It's as simple as that.
Parents who keep their kids.
Oh, and sorry, I should just add, we are, as I made this point a few days ago, but I'll just remind everybody, we are working very, very hard to have a stockpile of care packages. So if a person was to find themselves isolated at home, quarantined at home, and needed the basics, we will get those basics to them. Now those packages will vary, families, all sorts of different products that different people might need, but the fundamentals, we would always make sure that people had those, and in fact we have been doing that right throughout these last few weeks as people have been at home on the best of medical advice. We'll have more to say about those care packages soon, but we're very confident that we can get the basics to people in the event that they are in their house and unable to go shopping.
Is there any punishment, or what's the message to parents who decide to keep their kids home before any school bans are put in place?
Oh, look, I think that if parents exercised a judgment, they're not going to be punished for that. I think that an abundance of caution is never a bad thing. The other thing too is, of course, there will be many children, many adults who may have been at close contact. They'd of course be contacted by relevant authorities, but there may be other people, and we're going to see more and more people in the community who are exhibiting symptoms. And if you're exhibiting symptoms, the best thing to do is to ring the hotline, get advice, and then almost certainly the advice will be that you stay at home. So an abundance of caution drives so much of this, as it should. It's only through that approach that we can hope to flatten that curve, keep our hospital system running, not just for COVID-19 patients, but for everybody else who needs critical care every single day.
Premier, we've seen already.
National Cabinet today, you talked about travel and you talked
Yes.
about stockpiling. What else is on the agenda?
Well, the main item on the agenda will be to get will be the social distancing, those gathering issues. So we made some broad decisions on Friday based on advice, and then we said that we would take the next couple of days, so yesterday and today, to refine that and to provide further advice to people on how that will be applied. That'll be the main item on the agenda. There'll also be just a general update in terms of cases across the country, as well as any developments that have occurred overseas. I don't think it'll be a very long meeting. It'll be to talk about and ultimately determine how we're going to put into effect, particularly the advice on those gatherings of 500 or more people.
Will we be getting exact clarification on what's involved with those bans after the meeting?
Yeah, I think you will be, yes. That's the purpose of the meeting, and I think that there'll be some statements, and then obviously there'll be a need for us to get that information out to as many people as possible, and that'll be the job of governments and chief health officers in each and every state.
We're telling people not to panic buy.
Are they much the same as schools?
Sorry?
What's the situation with universities? Is it much the same as schools?
Well, I think the notion of essential versus non-essential, the notion of static environments versus dynamic environments, moving environments where people are not necessarily sitting next to each other for long periods of time, all of those are relevant factors, and I think we'll be able to give you greater clarity once that meeting at 12 o'clock has happened. The advice on universities is no different to the advice on schools. There may come a time when universities or other very large workplaces will have to be impacted. I dare say the non-essential gatherings of 500 or more, that will disrupt universities. There will be many gatherings at universities, if it's anything like when I was at uni, that will have more than 500 people. Based on what we're talking about today, I expect those advisories, and it could even go beyond that, people may well be directed to apply the advice. I think the universities will finish up being impacted.
Premier, we're telling people not to panic buy. They're continuing to panic buy. I think we can't stop that at this point. There's no juries in the courts.
Correct.
Why not just shut it all down for 2 weeks? Shut the schools down and get ahead of it.
Well, what I'd say to you is every step that we are taking is designed to get ahead of this curve and to indeed flatten that curve. Less people getting the virus over a longer period of time, avoiding that catastrophic peak, being much bigger, much sooner, and therefore completely swamping and overrunning our health system. That's everything we are doing is aimed at delivering that outcome based on the very best of advice. If there's advice about schools, I won't hesitate to act. Universities, whatever the context. It's really, really important that politicians are honest and clear and can make decisions quickly. We will deliver on each of those fronts. But politicians are not doctors and they shouldn't be replacing the expert advice that our Chief Health Officers provide. That's what they're there for. Brett's doing a fantastic job in very challenging circumstances. I intend to keep following his advice because that's the only way forward.
Just a question for Brett.
Certainly.
How many tests have we done in Victoria, and are there enough tests actually being done? Like, what's the rate of testing? And also, what's the wait time for any results?
We're over 14,000 tests as of today. There's a couple of thousand tests that are being done every day. There is a global constraint on testing swabs and reagents, and so we have to be absolutely mindful of that. There's no easy solution. There's more in process to be ordered, but we have to be diligent about how we focus our testing. We want to focus on populations who have the greatest risk of turning up positive so that we can identify those cases and isolate them. Really, really broad testing of tens of thousands of people might be great if we had all of those reagents and swabs available, but given those constraints, we need to focus on the populations most at risk. The 14,000 tests that have been done to date have turned up 57 positive cases, so that's a very, very small proportion. And the social distancing measures that we're talking about, including the 500 threshold, are really important regardless of whether or not you return a positive test. They're things for everyone to do across the board that will flatten the curve.
So there's people out there who've probably got COVID-19 that haven't been tested?
Indeed, across the world. There will be people out there who are positive, who haven't been tested, possibly because they've got very mild symptoms, and indeed haven't travelled now, so local transmission occurring. That's why social distancing measures need to be in place now for everyone. That's why everyone who's unwell needs to stay away from school, stay away from work. And so the point about the 500 threshold is not just that there's a magic risk above that and not before. There's a whole suite of things that people can do at a household level, at a community level, individually, that can make a difference. And a key one is if you're unwell, to stay away from work, to stay away from others, especially the vulnerable.
Are people being turned away from testing if they haven't been overseas or if they haven't been in close contact? And the second part to that is, when will you start testing everyone based on the fact that there are contact-to-contact transmissions?
There are limits to those that coming through the screening sites in terms of how many swabs that they can do on any one day. They are, as we've directed, focusing on those who are most at risk. And so not everyone who has a cold, and there'd be about 250,000 in Victoria on any one day, can get tested. That's appropriate that not everyone who's got compatible symptoms but is not necessarily in a risk group gets tested. So yes, some people who may feel that they should have a test won't be able to get one. To the extent that we can scale up testing, we will try and broaden that, because testing is an important thing to identify the positive cases and really focus on their isolation for the entire time that they're infectious and their close contacts to be quarantined.
Where do swabs come from? Is that something that's manufactured in Australia, or are they coming from overseas?
No, they're largely part of the global supply chain. This is the challenge for Australia. It's a challenge for a lot of places in the world, and of course the demands in Europe, in North America now, are enormous. And so we've placed significant orders in, and we're hoping that all those contracts will be upheld, but the pressures globally for all of those products are really substantial.
How short are we on those testing kits?
We can still do over 1,000 tests a day, but we need to be mindful of how long that will last for. We don't want to scale up to 10,000 tests a day and to be finished in a month.
On very simple point, you need to be able to reserve capacity to test health workers and others that are critically important to providing care, for instance. And if we go testing people for peace of mind and nothing else, particularly given that for the vast majority of people the symptoms are mild and they will fully recover at home, we just wouldn't have the kits when we need them most. That then means if you're not testing everybody, just relying on test results can't be the determining factor for your policy settings. That's when you have to move to things like gatherings over 500, social distancing. All of this is logical. It's very emotional too, but it is logical, based on common sense and the best advice, erring on the side of caution. With a clear plan, hard work and the help of Victorians, we will get through this.
There's a new working week, new school week starts tomorrow. What can people expect over the next few days in terms of their everyday lives?
Over the next few days and the next few weeks and months, people can expect significant disruption in events, in the workplace. Many people can expect to become ill with this. The vast majority of whom will be able to recover at home and their symptoms will be mild. The other thing people can expect at the beginning of a new work week and for the weeks and months ahead, that the government has a clear plan. The government will follow the advice of the health experts. We will work hard, and with your help, Victorians will get through this pandemic.
Just on social distancing and turning going out to work, what plans are you changing going to make to public transport? You get on train peak hours.
Sure. I've already said last week that there's inevitable changes to the way public transport works, and that'll be driven by two factors. One, social distancing, and two, we will finish up having staff shortages in every sector as more and more people become ill and more people stay at home. That's the right thing to do, staying at home, not needlessly infecting other people. If people come to work with symptoms, if people go about as normal with symptoms, then we won't flatten the curve. We'll in fact contribute to that catastrophic spike that sees our health system overrun. There'll be big impacts on PT, there'll be big impacts in every sector of the economy, in every part of the state. I think it's just fair to be honest with people about that, but also to reassure every Victorian, we have a plan, we're working hard, but we need your help. We need your cooperation and your assistance. That's how, given that we're all in this together, that's how we will get through this together.
But should people be avoiding using crowded public
No, at this stage, health advice does not extend to that, unless, of course, you had symptoms, in which case you should be avoiding all public settings. You should be at home getting well, and that's the experience for the vast majority of people who have mild symptoms. The hotline is the thing to do. Ring the hotline, go to the website, get the best advice, most contemporary advice, and then move forward from there. This will have to be the last one because I've got a cabinet committee I have to get to, I'm afraid.
Premier, you say it's like it's a case of when instead of if with schools. Are you looking at blanket closure of schools, or will it be done in pockets?
I don't want to speculate beyond just being as frank as I can. I think there's going to be significant disruption to schools. The exact nature of that disruption is not certain yet. There's a range, if you like. There's lots of different things that might happen. But I think we can expect, and we're already planning for the fact that there will be significant disruption to schools, and indeed significant disruptions to every setting, from childcare to aged care, schools, universities, TAFEs, workplaces, public transport, big events and small. There will be a massive impact. The alternative is to let this run, have our health system overwhelmed. That's bad for those who need treatment for COVID-19 who are really serious, and all the other patients who every day need the critical care that only our health system can offer. Thank you very much.